Entergy is proud to support programming on LPB and greener practices that preserve Louisiana.
The goal of our environmental and sustainability initiatives really is to ensure that our kids and future generations can be left with a cleaner planet.
Additional support provided by the Fred B. and Ruth B. Ziegler Foundation and the Ziegler Art Museum located in Jennings City Hall. The museum focuses on emerging Louisiana artists and is an historical and cultural center for Southwest Louisiana. And the Foundation for Excellence in Louisiana Public Broadcasting, with support from viewers like you.
It just feels like we're in a huge science experiment because the data changes so often.
Vaccine hesitancy grows in the South.
That's why you do research in the first place.
A Baton Rouge doctor's work going global.
We need to support people and meet them where they are and get them to that next level.
Inside the fight for better early childhood education.
Hi, everybody. I'm Kara St. Cyr. Andre Moreau has the night off. Much more on those top stories in a moment on this week's edition of SWI. But first, in a press conference Tuesday, Governor Edwards announced that he was loosening some of those COVID-19 restrictions. Restaurants, gyms, and casinos can operate at full capacity. Restrictions on bars are also loosening. Bar owners can now serve alcohol past 11 p.m., but all sporting and outdoor events will remain at only 50%. Of course, city ordinances still apply to all of these businesses, and that mask mandate will stay in place through all of these changes. Governor Edwards said that while the new guidelines are good news, it isn't time to be complacent, especially when it comes to getting the vaccine.
The month of April is going to be critical to our success. We're going to have more doses than we've had at any point up to now, and it's within our collective ability to make tremendous progress against this pandemic. In order to further this effort, I'm excited to announce that as part of our Bring Back Louisiana campaign, we are also standing up a vaccine hotline. Existing contact tracing workforce members will be cross-trained to respond to this new stage of our COVID response. It's a smart solution, it is timely, and it comes at no additional cost. The hotline will be able to schedule residents for vaccine appointments tied to our pilots and all LEH vaccine events. It will help navigate the larger system of vaccine providers and locations and connect residents to a medical professional for any questions that they might want to ask about the vaccines. This is a big deal. Our campaign is all about meeting people where they are, breaking barriers so that everyone has the opportunity to get the vaccines. This hotline addresses at least two specific barriers. One, the lack of access to internet, tech savviness, or the time and ability to navigate our network of providers and events to schedule a vaccine. And two, lack of access to a medical professional to answer specific medical questions. LDH will train 60 call agents, 10 specifically for clinical support, and that'll happen this week. We know that many eligible Louisianans have jobs that make it tough to schedule appointments, get their questions answered, and get the vaccine during the day. So this hotline will also help address that barrier with its hours of operation. The hotline will be up and running next week.
The governor's office will reveal more about that hotline in coming days, including the phone number and how to use it. And now to other news making headlines across the state.
Louisiana realtors are asking landlords to apply for rental assistance through Louisiana's U.S. Treasury Emergency Rental Assistance Program. The state was recently granted $300 million in relief money to help landlords get some financial assistance. The CDC's eviction moratorium was difficult for some renters trying to keep up obligations and house some tenants who were not able to pay. The Louisiana Housing Corporation, partnered with the Louisiana Office of Community Development, will be heading this operation. The aid will be available in 57 parishes. Larger parishes will have their own programs. Researchers with Public Policy Research Lab at LSU found that people living in Louisiana are losing faith in the government to remedy the economy and the pandemic. Out of 781 adults polled, 46% say that the state is heading in the wrong direction, which is a big shift from a 2019 survey where only 43% believed the state was headed in the wrong direction. The survey also revealed that the pandemic has shifted what people think the state's priorities should be. Right now, people are most worried about the pandemic and the economy versus the transportation infrastructure and education, which topped the list 2 years ago. The Catholic Order is looking to right a wrong done hundreds of years ago. The Jesuit priests are pledging $100 million to the descendants of slaves they once owned, also known as the GU-272 in Maringouin, Louisiana. The money will be pumped into the Descendants Truth and Reconciliation Foundation. Foundation and church leaders say the money will be used to start racial healing projects and will be doled out to the descendants in the form of scholarship money and other projects. The East Baton Rouge Parish school system is trying to make up for valuable time lost during this pandemic. Superintendent Cito Narcisse announced the Smart Start plan, which will add 8 more days to the school's calendar. Kids would start the 2021-2022 school year on July 28th, while teachers and staff members will begin meeting 2 weeks before the start of the year for professional development. The plan will go before the school board during their meeting on April 22nd. Relief is on the way to Louisiana families affected by the hard freeze in February. DCFS approved DSNAP operations, which provides food assistance to households that do not already receive SNAP benefits. The sign-up process will start in 2 phases. One will be on Monday, April 5th. The other will be on Saturday, April 17th. All 23 parishes that applied for the assistance were granted the DSNAP benefits.
Also making headlines this week, Saints and Pelicans owner Gail Benson made a surprise donation to the United Negro College Fund. At the organization's masked Mayor's Ball, Benson made a $1 million donation to help funding for HBCUs. The UNCF president, Michael Lomax, said the donation will help minority students further their education. As vaccination becomes more accessible to the public, some people can't set an appointment fast enough, while others are still not sure if that's the route they want to take. Experts are calling this vaccine hesitancy. I sat down with Dr. Joseph Kanter from the Louisiana Department of Health and Dr. Pam Simmons with Women's Hospital to debunk some myths about the vaccine and talk about why some people may be afraid to take it.
Last week, the governor announced that everyone can qualify for the vaccine if they're 16 and older. For some, that news is the light at the end of the tunnel. For others, it's another question mark in a slew of unknowns. Deanna Bourgeois finds herself wondering if the vaccine is really safe.
I mean, I wish I was just very assured and wanted to go get the vaccine. I personally, it just feels like we're in a huge science experiment because the data changes so often. And even though we have so much trust in the medical field and in scientists in general, they're not always right. That on top of just your peers and your outer circle, so many people are completely against the vaccine. So there's we're divided in half.
Bourgeois isn't against getting the vaccine. She wants to be safe from COVID-19, but she's also worried about the effectiveness of it. Is it safe to take something that was quickly distributed? Kimberly Burat is in the same boat, except for her, the issue is slightly more urgent.
Because I'm allergic to various medications like pain medications like Lortab and even prednisone that normal people are able to take for the common cold or even for pain management, I'm allergic to those. And so being that I'm allergic to things that a lot of people aren't allergic to, the fear is definitely there that I don't want to have an allergic reaction. So that's probably my biggest concern of anything. I want to take the vaccine because I don't want to worry about the harmful effects of COVID or even hospitalization. But I'm also really scared of it.
It's not the vaccine itself that scares these women. It's what happens after. Both of them are worried that the vaccine wasn't tested long enough to truly know the side effects. These two aren't alone. Vaccine hesitancy is real. According to the U.S. Census Bureau, the CDC, and the National Center for Health Statistics, hesitancy is dropping, but not in the South.
I think there's a lot of myths out there. I really do. These happen to be not only very effective, but very, very safe vaccines. And when people speak with an expert, they speak with someone that has understanding of the facts, I think they become more comfortable. One of the things that's been really encouraging to me, as I've spoken with individuals who, might be labeled as vaccine hesitant, and as we've conducted focus groups on the issue, is I'm not hearing a lot of people say, I don't want it 100%. I'm never going to get it. I really don't hear that. What I do hear more of is people with uncertainty and people that are saying, I don't know.
For many people, the question stands: will there be long-term side effects that will be harmful for people taking the vaccine?
This notion about delayed reaction or what's going to happen to me a couple months down the road or a year down the road, we typically don't see that with vaccines. There are not a lot of delayed reactions, if any, with vaccines. There are some reactions with other vaccines that happen quickly within a couple weeks, usually, maybe a month, but even that's pushing it.
Kanter says the reaction you're likely to see is just arm soreness and flu-like symptoms. Some people get headaches, and there may be some fatigue, but Kanter says this is just proof that the vaccine is working. To fight against the virus, your body needs to see how it'll be affected. And as for Burat's allergy dilemma,
just being allergic to medications is not a reason to not get the vaccine. It's not what we would call a contraindication. And I guarantee you, individuals that have allergies to other medicines have gotten other vaccines. I absolutely guarantee you that they have. That said, people that are concerned about an allergy should know that any vaccine provider that is giving out the COVID vaccine has an EpiPen on site in case there should be a bad reaction. And if anyone has concerns beyond that, they can look for a hospital to give the vaccine out to them. They can get the vaccine in a more acute setting like a hospital. So God forbid if something happened, they would be there already.
Pregnant women also have some reservations toward the vaccine. And a lot of it stems from the fact that none of the vaccines were tested on pregnant women specifically. But Dr. Pam Simmons at Women's Hospital says that's nothing to be afraid of.
Thousands upon thousands of pregnant women have actually gotten the vaccine. And so there is current studies undergoing with them and looking at safety data to say that, is this safe in pregnancy? And based on how the vaccine was came up with, right? So this is an mRNA vaccine that's been looked at before, right? And so that has been shown to be safe, and that in theory should not affect anything from a pregnancy standpoint.
Simmons says that women who didn't know they were pregnant were a part of the COVID vaccine trials. Scientists kept track of these women and haven't found any evidence of side effects. But even more shocking, pregnant women getting the vaccine may actually be a good thing.
There's been some new emerging data and a few what are called like case reports about women that have received the vaccine that have actually been able to pass the antibodies on to their newborns. So that's very promising data that as a mom, one of the things that I can do to help prevent my kiddo from getting COVID-19 or be exposed to that is to go ahead and pass antibodies on. That now as more and more pregnant women are getting the vaccine and being able to see the hopefully the benefits of being able to pass those antibodies on to their children is just great. I mean, that's one more step of things that I can do about myself staying healthy and being vaccinated to be able to pass that on to my kiddo.
As vaccinations grow and become more common, Burat and Bourgeois say the likelihood of getting the vaccine is increasing for them, but the fear is still there.
Dr. Kanter and Dr. Simmons ask that anyone with reservations about the vaccine reach out to a doctor. They can clear up any questions and uncertainty. An update now on the peer-reviewed and published COVID-19 research work of a Baton Rouge doctor. He designed a simple taste test to predict outcomes and the severity of the novel virus. We've reported extensively on why someone is a super taster or a non-taster, but all the research has flown largely under the radar, at least until now. LPB's Moreau reports why that is likely to change.
Dr. Henry Barham tells me since his COVID research began using this taste test, his goal was to make the test available globally so everyone anywhere in the world could have access to it. And even though he pokes fun at it, he says it's because of his and his team's passion for research that it's on the brink of happening.
If this little nerdy science project about something in the nose that contributes to taste were to help in some way, that's incredible. And that's why you do research in the first place. This virus has disrupted our world more than, I consider myself young, I'm 38, but I have never seen anything like this. But when I talk to my parents, and like analogous to like a world war or like great influenza, a generational change to our entire world.
He tells me by mid-June, an at-home taste test kit should be ready for global distribution. After months of talks with major investors worldwide, it is the first product of a brand new company called Phenomune. Even though peer-reviewed published COVID research is what led to the company's existence, you won't find mention of it. Instead, overall wellness is the theme with the bitter taste sensitivity kit. Dr. Barham is the Chief Medical and Scientific Officer.
What will this product mean, and what can it do for the world?
In America, we have the benefit that we have a lot of resources. We have a high vaccination rate, which continues to rise, which is great because that's ultimately how we get past this. But on a global level, there are a lot of places that don't have those resources. And so the beauty of this test is that it is a simple, cost-effective, safe, easy, scalable test that can be used to help predict severity and duration of illness if people were to get the sickness.
On our SWI broadcasts, we've covered Barham's pioneering research from the beginning. I took the test during our first report in September, as Barham handed me 4 strips of paper to place on my tongue one at a time.
And then you tell me, do you taste sweet, salt, bitter, or nothing?
When I didn't taste anything, that appeared to put me in the non-taster group, the group his research shows COVID hits the hardest and puts in the hospital. On the opposite end, the super tasters may recoil at the bitterness they sense, but rejoice because their COVID symptoms, if any, are mild, no hospital. Now, at the time, Barham told me taste receptors dull with age, so I could be a taster in the middle group. During our next report in his research, in December, I took the test again at a small family Christmas gathering. This time, though, Barham had me drink black coffee right before, and the difference... He says a person's taste receptors can be awakened and stimulated. Pills that do this could be another layer of the Phenomune regimen.
It seems like this has opened up a world of possibilities in other illnesses, perhaps.
To your point about multiple diseases, this expression of this family of receptors and a different group of receptors has already been studied to a lot of upper respiratory infections, recurrent ear infections, recurrent sinus infections, bacterial, inflammatory conditions. The data that we have specific to COVID simply improves the data behind the value of the knowledge of the expression of these receptors. We now are continuing to study it to other upper respiratory infections, specifically viral, because of how impressive the results have been specifically to COVID.
What excites you the most about this?
So we set out to find an association between each person's level of expression of this family of receptors as it can predict one's duration and severity of symptoms should they get COVID. We hope to have something widely available, inexpensive, in my mind, which is important, on a global scale to help get past this.
Andre says the cost of the kit is $21. You can pre-order on the website with the mid-June opening. For more info, check out phenomune.com. There's a lot of praise going around for LSU's Early Childhood Institute, which opened last week, but without some changes, are expectations unrealistic? Andre Moreau had a discussion with Institute Director Cynthia DiCarlo and Richard Baker, Associate Director of the School of Education, about the Institute, touted as a hub for activities.
Center of Innovation.
Social responsibility.
Transforming education.
Positive change.
Groundbreaking research. Teacher leaders.
How vital is this at this time for Louisiana?
The early years are critical. There's a lot of learning that happens in the early years through play, but you do need an educated care provider in order to understand how to facilitate that development and how to support families and facilitate their children's development at home.
It's critical now, but it was critical a year ago. It was critical 10 years ago. It's still going to be critical 10 years from now. What I think that this institute is going to do is, I really think it's a game changer for Louisiana. And the excellent things that Dr. DiCarlo has done is putting together. It is easy for me to say that she is laser focused on making early childhood education and turning out quality early childhood educators.
What I think a lot of people don't realize is that even though the greatest development, the greatest burst of brain development is the birth to 3 years, it's where we have the least educated early care providers, the least educated teachers. And that early care and child care is really not a system. It's a loose collection of business owners. And that while we do have minimum foundation funding for K-12 education, early childhood is funded on the backs of young families. And so there really is about a 50% difference between what public school teachers make and what childcare teachers make. Actually, the US Census for this year estimates that childcare teachers in Louisiana make a little over $18,000 a year. Given that our teachers make poverty level wages, it's very hard to attract and retain high quality teachers that will make a difference in the lives of young children. And so with the increased focus on kindergarten readiness, there is no system of support for the first 3 years. When the state moved toward having universal preschool, which is a wonderful thing, I don't think at the time anybody realized what that would do to child care centers by taking those 4-year-old classes and moving them into public school. Many child care centers charge a flat rate for infants through 4-year-olds. And by taking the 4-year-old programs out, that's really where they kind of made up their money. And so what that caused as a result was really a lack of opportunities for infant to 2-year-old care. So that is really a critical shortage in the state, that there's simply not enough placements. And while it's a wonderful thing that we're funding placements for young children, we can't lose sight of the impact of a quality environment versus just a placement.
What is your expectation of what we will see happen and the work that this institute will provide?
As the superintendent has said, as the governor has said, the early childhood years, this is a critical time for development. And what this research institute is going to do, LSU is a land grant institution. It also has a sea grant, it's a space grant, it's an air grant, but the land grant, what that means is that we develop things to help make Louisiana better for Louisianians. That's what LSU is about. And this early childhood center is going to help do that for our youngest citizens.
And it really is just in the last year that our state has developed a certification structure for birth to kindergarten, which is a little behind other states. And so now that this is available, we need to incentivize people getting this training, because it is really cost prohibitive to, when you're making $18,000 a year, to think about getting a college degree. And we need to support people and meet them where they are and get them to that next level, because it is every bit as important for a birth to 3 teacher to be degreed and certified as it is for a high school chemistry teacher.
COVID has certainly opened up the eyes and made some things really revealing with all of this, I would say.
Right. We are essential to the economy. Things can't get up and running without childcare. That's just the facts. And so we're called essential, but we really need to be treated like we're essential.
I would really like to see, us change the conversation and rather than, make teachers, the scapegoats for a lot of things. We need to be elevating them if we're going to encourage them into service, which is what this is.
Any money for increased salaries for early childhood teachers is unclear, but essential, as Dr. DiCarlo said. For more information, go to ecei@lsu.edu. And coming up next week, LPB will air a 3-part 6-hour documentary series by Ken Burns on Ernest Hemingway. Hemingway will air 3 consecutive nights, April 5th to the 7th, from 7 p.m. to 9 p.m. Each episode is followed by Louisiana-themed documentaries spotlighting authors who were either born in or inspired by our state. Burns and Novick explore the painstaking process that Hemingway went through to create some of the most important works of American literature in the 20th century, while also debunking the myth of Hemingway as the ultimate man's man. What's revealed is a deeply troubled and tragic figure. The film also explores his limitations and biases as an artist. And also a reminder that the deadline to nominate a Louisiana Young Hero has been extended until Sunday, April 18th. So if you know any Louisiana students who've shown exemplary work, be sure to submit them. For info on how to send in a nomination, check out lpb.org/youngheroes. That's our show for this week. Remember, you can watch anything LPB anytime, wherever you are, with our LPB app. You can catch LPB news and public affairs shows, as well as other Louisiana programs you've come to enjoy over the years. And please like us on Facebook, Twitter, and Instagram. For everyone at Louisiana Public Broadcasting, I'm Kara St. Cyr. Until next time, that's the state we're in.
Entergy is proud to support programming on LPB and greener practices that preserve Louisiana.
The goal of our environmental and sustainability initiatives really is to ensure that our kids and future generations can be left with a cleaner planet.
Additional support provided by the Fred B. and Ruth B. Ziegler Foundation and the Ziegler Art Museum located in Jennings City Hall. The museum focuses on emerging Louisiana artists and is an historical and cultural center for Southwest Louisiana. And the Foundation for Excellence in Louisiana Public Broadcasting, with support from viewers like you.